Hey guys, this is Vincent Obita, and today we are going to cover evaluation station in Osce new test of competency, and this is an oral submission where you are supposed to direct it to the assessor and give a handover report to the next carer using the SBAR technique. This is a situation, background information, assessment, and recommendation of care. It takes around 10 minutes, and what is expected of you is view all the information you had right from your assessment, planning, and implementation, then hand over that patient to the next caregiver. Your submission, you can take this in form of, you don't need to use like the 10 minutes to be talking throughout. Take the first few minutes to check what you need to include in these aspects. You will be given a paper, jot some things about the situation, about the background information, and assessment, then your recommendation. All these information are in your previous stations that you've covered, so you can spend like 2 or 3 minutes jotting them down and capturing all of them, then do your oral submission within that period as well. Remember, all that you are giving has to be within the timeline of that 10 minutes. So your oral submission can take this format. My name is Vincent Obita, one of the staff nurses at the gastroenterology unit, and I'm going to give you an end of day report concerning Joseph Smith. Joseph Smith, date of birth 20th of December 1972, who is currently in side room 1. Under background information, Joseph was admitted today morning, 20th of December 2022, admitted with a range of symptoms, that is diarrhea which has lasted for 3 days, loss of appetite, he has a left ankle ulcer, and also weight loss. Now, Joseph is a non-diabetic patient who is on insulin and metformin, though has not been very compliant. Is usually mobile and independent with activities of daily living. He does not smoke or drink, and he lives alone. Okay, that covers more background information of Joseph that the other party ought to know. Under assessment, I'll provide the vitals signs for this for Joseph. Joseph had a respiratory rate of 18. He had oxygen saturation levels of 98% on room air. The blood pressure was 129/69. The pulse rate is 86, and the temperature is 36.7. However, Joseph has malnutrition universal screening tool score of 4 and is currently managed for risk of malnutrition. Is currently on food chart monitoring, and also is also for on recording for stool, and is also for stool sampling. He is on Ensure supplements that he takes both in the morning and in the evening. His current main concern is low intake and also loose stool that is still ongoing since admission. That would cover the assessment aspect. Then under recommendation, you will, with all the information you've given out, you will now be providing recommendation to the next caregiver, what he needs to do like in the next shift, and what to look up to, what we are up to until the patient is discharged. So your recommendation would take like this aspect. I would recommend that to encourage Joseph to increase his oral intake as tolerable as he can. I would also recommend that you do 6-hourly observation of the vital signs, and also do weekly score of the malnutrition universal screening tool. The diabetic nurse should also review Joseph to place a plan for compliance with his medication to manage his diabetes. And also, due to the risk of malnutrition, I would also recommend Joseph to be referred to the dietitian to form a plan of care, and also things like meal plan, and also how you will handle all this during their stay in the hospital, and also in preparation of discharge. This entails all that you need to cover in your evaluation, and as you can see, I've also just taken around 6 minutes to cover all that. So you need not to talk for the entire 10 minutes, but spend some few minutes prior to your submission to jot what you need to do. You need not to write everything, but just a simple guide that you can use for your oral submission, and you can keep on looking into them as you do your submission to the assessor, because there is no offense in that anyway. You are passing a report, and the next party ought to capture all that need to be done. Thank you for listening for all that. Keep on looking up to various videos that we will be uploading in future, and also in case of any questions or any stuff that you need us to consider in our submission, then just place them in the comment section. I wish you all the best, those who are going to take their Osce in the near future, and just keep on practicing, because that's what makes you more confidence in your submission, even with the increased number of stations. It's doable and you can do it. Thank you, and until next time, have a nice day. Thank you. Bye.